There's a killer lurking amongst us, and we must work together as a community to take it down. Our country is facing an epidemic, and I'm not talking about the COVID-19 coronavirus. I am talking about the epidemic that our country is facing, hypertension, also known as high blood pressure. According to my Pearson Nursing Education book, hypertension contributes to almost 500,000 deaths each year in the United States. Hypertension is known as the silent killer because many people do not have any symptoms until irreversible damage or death has occurred. The best way to get in front of this epidemic is to check your blood pressure regularly and to seek medical treatment if necessary. Primary hypertension accounts for like 90% of people with high blood pressure. And unfortunately, the cause is unknown. The remaining 10% cases from hypertension comes from kidney disease, narrowed arteries, hormonal disorders, neurologic disorders, drug use, pregnancy, underactive thyroid, and sleep apnea, which means you stop breathing in your sleep. There are certain risk factors that do predispose people to developing hypertension, and those include excessive sodium intake, low potassium, low calcium, and low magnesium intake, as well as obesity, consuming too much alcohol, insulin resistance, a sedentary lifestyle, smoking, and low vitamin D levels. It is within our ability to alter these elements to promote a healthier outcome. There are some non-modifiable things that contribute to hypertension, like race. So African Americans have a higher incidence of hypertension, as well as age, so adults 65 and older, and family history of people who have hypertension. These are things that we cannot change, but monitoring your blood pressure regularly would still help you in the end. If hypertension is left untreated, it can lead to stroke, heart attack, kidney disease, and kidney failure, which can all lead to death. So there are two ways to check your blood pressure. First, there's a manual check. And for this, you would need a stethoscope and a blood pressure cuff. It is important to choose the appropriate cuff size. The standard size works for most adults, but there are some larger cuffs as well as some smaller cuffs available. You do need a stethoscope for this, and what you would do is place the blood pressure cuff on your upper arm, and then you would place the stethoscope in the crease of your arm, in the fold of your arm, and you would pump up the valve to at least 180 on the dial, and then you're going to slowly release the pressure by turning the dial the opposite direction. You want to listen for the first sound that sounds like a heartbeat, and remember that number. And then you want to listen for the last sound that sounds like a heartbeat, and record that number. The top number over the bottom number is what your blood pressure is. The second method for checking your blood pressure is a digital monitor, so an automatic way to do it. And for this, you do not need a stethoscope. So you can find either of these online or at all of your major local retailers. And the cost would run from about $20 to $100 or more. So a normal blood pressure reading is going to be 120 for the top number and 80 for the bottom number. You're considered to have stage 1 hypertension if that top number reaches 130. If the numbers are any greater than that, you'll want to seek treatment with your primary care provider. There is a life-threatening condition known as hypertensive crisis, and that is if that top number is 180 or greater, or if the bottom number is 120 or greater. This is an emergency situation and you will need to call 911 immediately. So, ways to prevent hypertension, the best thing you can do is live a healthy lifestyle. And that includes weight loss, regular exercise, no smoking, limited alcohol consumption, reducing stress, and eating a balanced, nutritious diet with a low sodium intake. The American Heart Association recommends an upper daily limit of 1,500 milligrams of sodium each day, and that's in a healthy adult. So there is a diet known as the Lower Dash diet, and that has been proven effective in lowering blood pressure, as well as offering guidelines to maintain that 1,500 milligrams of sodium intake. So treatment for hypertension is going to include medication therapy, very likely. There's a host of antihypertensive medications out there, and your provider would prescribe the best one for you. Even with medication, you'll have a better outcome if you couple that with living a healthy lifestyle and eating a balanced diet. Now, when tragedy strikes and unexpectedly disrupts our lives, we often find ourselves reflecting back on what we could have done to prevent that. So this is our chance to make a positive impact on our health and promote longevity by making small lifestyle modifications and keeping an eye on our blood pressure. My request is that you take this very seriously and implement these changes in your life today. Spread the word and save a life.